The government's roadmap out of lockdown for England saw COVID restrictions gradually eased until they were fully lifted on July 19th. New research from Imperial's COVID-19 response team, published in the Lancet, looked at how effective this strategy was and what could happen next.
The aim of the roadmap policy was to relax restrictions in a gradual manner that would mirror and be offset by the gradual increase of population protection through vaccination. Our study shows that the roadmap was very effective in keeping transmission at levels that were just low enough to avoid a large epidemic rebound, whilst having as few restrictions as possible.
We quantify this using a version of the R number that tells us what would have been the level of transmission if there were no protection from past infections and vaccinations. With the emergence of the Delta variant, the virus was suddenly able to spread much faster and also escape some of the protection provided by the vaccines.
If Delta had not emerged, there would have been no third wave in England, because the roadmap would have meant that population protection was high enough to prevent severe cases and hospitalizations before restrictions were lifted. Delta completely changed this balance between population protection and social mixing.
This resulted in a decision to delay the roadmap by a month to allow for the vaccination program to catch up. Interestingly, our models gave a strong signal that we needed to pause the lifting of restriction, and that allowed the roadmap to get back on track. A mathematical model can be extremely useful in informing policymakers, while ultimately, we modelers are not the ones making the decision. We can help figure out what will be the impact of specific policies.
Variants of concern remain a threat to successfully controlling the epidemic, so we need to have a global approach to epidemic control and vaccination to reduce the risk of future variants emerging. It's really difficult to predict what the epidemic in England may look like in future months, because there are still uncertainties around vaccine effectiveness, social mixing, and the duration of immunity. As people return to work and mix more, there could be another epidemic peak before the end of the year, but it should be smaller than last winter.
Unless the virus develops a mutation with the ability to escape the current vaccine, we should be in a much better place than last year.